Okay, so this is the last video we're going to look at SLE, and in this video I'm thinking we just pass through a couple of questions, starting with this one. A 15-year-old girl presented to the hospital with anemia and joint pains. You note she has a rash as shown below. So 15-year-old girl, that's a risk factor. She has anemia, she has joint pains, and she has this rash. And coming to the rash, if you were to squint your eyes, tilt your head a bit, this kind of looks like a butterfly. And notice how it's pairing the nasolabial folds. So this is the butterfly rash or the malar rash. What is the diagnosis? This is clearly SLE. What other four features are used in the criteria to diagnose the condition above? That is not given in the scenario. So I like to divide the body into different sections. That way it will be easy to remember the clinical manifestations or the clinical presentation of these patients. So from the head to the toe, we are saying altered mental status, memory loss, behavior changes, seizure, coma, alopecia, the malar rash, discoid rash, oral ulcers. Coming to the heart, we would have that pancreatitis, the lungs, the pulmonary hypertension, the lupus nephritis at the level of the kidneys, the joint pain, and of course the signs of anemia, the pallor, palpitations, the fatigue. So you can choose from any one of those since SLE will affect multiple systems of the body. These two important investigations to confirm the diagnosis. Remember that when we're dealing with SLE, we want to start by doing ANA, anti-nuclear antibodies. ANA is highly sensitive, but it is not specific. So multiple conditions are also going to have a positive ANA. Conditions like rheumatoid arthritis, scleroderma, and so forth and so on. So we start by ANA, and we can do anti-Smith or anti-double-stranded DNA. Those would be two important investigations. So you can choose either one of the two, anti-Smith or anti-double-stranded DNA, but ANA also has to be there. What are the two complications of the condition? So at the level of the kidney, we can have the lupus nephritis, which can then go into chronic kidney disease. From the heart, you can have the endocarditis, which might be noted. Just from the pathophysiology, you're just choosing certain complications. What drugs are used in the treatment of this condition? Remember, you start with your hydroxychloroquine, the anti-malarial drug. You can put prednisolone, you can put NSAIDs for the arthritis. Okay, so this was the first question. On to the second one. Okay, a 35-year-old female patient presents to Levi-Mwanawasa General Hospital with arthritis of the small joints in the hands and a seizure disorder. She has a history of being unwell for 3 months now and has had some episodes of irrelevant talking during this period. 2 weeks ago, she noticed some eruptions on her cheeks, which have persisted until now. Her past medical history is only significant for anemia and a history of miscarriages. On admission, you decide to do urinalysis, which showed the following parameters: proteins 3+, blood 2+, glucose nothing, and the specific gravity of 1.015. Again, looking at the risk factors, we've got a female of reproductive age. Coming on to the clinical presentation, there's arthritis, there's a seizure. We are also having some sort of behavioral changes. Then she has some sort of rash on her cheeks. Remember the malar rash. And anything else? She has anemia and she has miscarriages. Remember antiphospholipid syndrome. Women of reproductive age, it would be a good thing to look out for miscarriages. The urinalysis is showing some sort of nephritic syndrome. Again, remember when it affects the kidney through that rapidly progressing glomerulonephritis, which can cause some kidney damage. Okay, what is the likely diagnosis? This is obviously SLE, systemic lupus erythematosus. Mention 5 clinical features you would look out for. Again, just think of it from head to toe: alopecia, seizures, memory loss, psychosis, coma, malar rash, discoid rash, palpitation through signs of anemia, the joint pains, the lupus nephritis through proteinuria, hypertension, and body swelling, so forth and so on. Just think about the particular system and you kind of think of how it would manifest. What could be the rash on her cheeks? So that's the malar rash or butterfly rash. List 3 diagnostic investigations you would request for. Emphasis on diagnostic. We are starting with anti-nuclear antibodies. ANA positive, we can go to anti-Smith and anti-double-stranded DNA. What is the likely renal complication in this patient? So we are seeing some sort of nephritic syndrome that this patient is having. This is lupus nephritis. Okay, so this has been the last video on SLE. Thank you for watching this video. Peace.